Hi friends, hope NEET PG 2024 has gone well with you all. It has happened on 11th of August and MedAce team is bringing you all with a rapid recall of the questions of NEET PG 2024. I am Dr. Vinay HR, subject expert in the subject of psychiatry, who will be taking you through the questions and right answers. Again, of course, it's with a disclaimer that all the questions have been based on the recollection of some of the students. There can be minor errors and it is not exact the questions in which they were asked in the NEET PG. Okay, right. So altogether there were around 12 questions, 6 questions each in the morning and evening session. So let's go through these questions. Morning session questions. The question asked was which of the selective norepinephrine reuptake inhibitors is used in the treatment of ADHD? Remember the SNRI here. Okay. So the right answer is reboxetine. Okay. All other options, methylphenidate, amphetamine, modafinil are stimulant medications, while reboxetine is the only non-stimulant medications with SNRI. Okay. So other SNRI is atomoxetine, which is used in ADHD. Okay. This question was covered under MedAce app under psychiatric disorders in childhood and adolescence under ADHD. Okay. Right. Second question. Which of the following medication is used for maintenance therapy in opioid dependence? Options were disulfiram, clonidine, citrated calcium carbamide, and buprenorphine. Remember, it's the maintenance therapy that they've asked for, not the withdrawal treatment. Okay, so here the right answer is buprenorphine. While disulfiram and citrated calcium carbamide are used in aversion therapy of alcohol dependence, clonidine is used in withdrawal treatment. Okay, now they've asked for maintenance therapy and hence buprenorphine, which has partial agonistic activity, is the right answer. Okay, this particular question was covered under substance use disorders, under which subtopic opioid dependence. Okay, right. So Alzheimer's disease has predominant deposition of following in the neurons. Okay, so Alzheimer's disease is a type of dementia wherein tau protein and amyloid beta proteins are the ones which accumulate and cause degeneration of neurons, while alpha-synuclein is for in Parkinson's disease. Okay, this question was covered under psychiatric disorders in the elderly under dementia in the MedAce app. Next question, a young female has frequent worrying, nervousness, abdominal discomfort and fidgetiness for 5 years. She reports of family members having also similar nervousness. What additional symptoms she might have? Remember here, frequent worrying, nervousness and abdominal discomfort and fidgetiness. They're all indicative of free-floating anxiety, which is more than 6 months, qualifying for generalized anxiety disorder. Okay, so hallucinations, which is a psychotic symptom, not. Ideas and reference, no. Neologism is part of again psychotic illnesses. So right answer is tingling and numbness in extremities, which is a part of a anxiety symptom. Again, in the MedAce app, this was covered under anxiety disorders, subtopic of generalized anxiety disorder. Next question, difference in interpreting the meaning of words in a message will lead to which communication barrier? Okay, so here linguistic would include language related changes, while the right answer here is semantic, wherein the language is not a barrier, but the meaning of the word which are interpreted wrongly will result in a communication barrier. While psychological barrier is nothing but difference in the mood states of a recipient, while cultural differences, again, it's a different cultures, people taking the meaning. Okay, so the right answer here is semantic communication barrier. Again, this was covered in the introductory chapter, wherein communication, components of communication was a subtopic in the MedAce app. Next, a man gets aroused only when he wears high heel and lingerie of women, but he reports of not sexually attracted to men. What is the diagnosis? Here, it is a sexual gratification by cross-dressing. Okay, so which is indicative of a sexual paraphilia. So the right answer is transvestic fetishism, wherein in gender dysphoria and all, they'll have a preference to cross-dress, and also they might have a sexual attraction to men with deferred gender. Okay. Voyeurism and masochism are other sexual paraphilias wherein the sexual gratification is because of viewing secretively or inflicting injury onto oneself. Okay. Again, this was covered in the MedAce app under sexual paraphilias. Okay. Coming to the evening session questions. A patient with alcohol dependence is admitted with a history of tremors, anxiety, sleeplessness, suggestive of withdrawal state. What is the following? Which of the following medication is part of the treatment? Remember, it is the withdrawal state. Okay. So, wherein the right answer is lorazepam. Why disulfiram is not part of the management of withdrawal treatment, rather an aversion therapy in the long-term management. While naltrexone again is a long-term management, while haloperidol is used for behavioral disturbances during delirium. Okay. Again, this was covered under MedAce app under substance use disorders, subtopic of alcohol use disorders. One other question on ADHD. Childhood ADHD persisting in adolescence is a risk factor for the following in adulthood. So which of this following is a risk factor for developing? So here the right answer seems to be binge eating, wherein it is the impulsivity, okay, which is carrying on in the adulthood as well. Some of these eating disorders, even anorexia, bulimia, are also found in adults who had childhood ADHD. Okay. While separation anxiety is a different, wherein the child has anxiety because of fear of separation from the closed ones. Okay. 30-year-old good looking male who is good with his family members but has history of frequent fights with others, traffic violations and arguments with police. What is the personality disorder he has? With whatever description here, frequent fights, that is violence, traffic violations, always entering into conflicts with the law. Okay. So kind of a manipulative, because he's with the family members, he's good. With others, he has this manipulative behavior. So this is classical of antisocial personality disorders. Wherein narcissistic is, it's all about oneself. I mean, most of the things are, directed towards self-appreciation, and he wants to become a center of the attraction and so on. Well, anxious personality is not there. None of the features are suggestive of. Another question. A young girl has history of episodes of loss of awareness happening only during the family members are around and also in the daytime when the patient is awake. She is able to recollect the events during the episodes once she gains a consciousness in few minutes. Okay. And there was no tongue bite or passing of urine or stools, which is indicative of incontinence. Okay. What is the management? Here, this episodes of loss of awareness happening only when family members are around, and no tongue bite and passing of urine, ruling out the genuine seizures. So the diagnosis here is kind of a dissociative disorder. Okay. So in such a case, it is the behavioral therapy which is important to reduce the gains and also address the conflicts. Okay. Sodium valproate is not used because it's not a genuine seizures that the patient has, while haloperidol and aversion therapy are not used in dissociative disorders. Next question. A 45-year-old female with repeated visits to plastic surgeon for non-existing facial deformity thinks she is ugly. Her parents try to convince her that she is not, but she does not believe in it. What is the further treatment on being referred to a psychiatrist? Okay. Here, in this case, the diagnosis is body dysmorphic disorder. Okay. So here, the treatment, first line of treatment is SSRIs. Okay. Other allowing the surgery, it will be reinforcing their ideas that they have that there is a definite deformity. While atypical antipsychotics are used as an adjunct medications if the belief, the conviction is so much that it is amounting to a delusion. Okay. So symptom-focused dynamic psychotherapy is not used in body dysmorphic disorder. The last question. A patient on sertraline was not improving and he was added with amitriptyline. Okay. So later it developed diarrhea, agitation, confusion and hypertension. So what is the next line of management? So here as you can see, sertraline and amitriptyline, sertraline being SSRI, amitriptyline being tricyclic antidepressants are combined. So it results in serotonin syndrome, okay, which is revealed here, diarrhea, agitation, confusion and hypertension. Okay. So in serotonin syndrome, wherein there is a excessive serotonin, so it is the cyproheptadine which is used, okay, which is an antagonist. Okay. While flumazenil is a benzodiazepine antagonist, okay, and N-acetylcysteine is used in a paracetamol poison. Okay. So these were the questions which are covered under MedAce app, wherein the answers have been mentioned and also in the notes of the MedAce, so they are available. So thank you for your kind listening. Here we come to the end of recall session. Remember, there were around 10 questions out of 12 questions which were covered under MedAce, Manipal MedAce app. So strike rate of around more than 80%. Okay. So in addition, MedAce app is prepared by the faculty and not by the students. Okay. And it gives a complete coverage of whole syllabus. It covers all type of questions like which are more real in terms of what is asked in exams. Okay. And it covers the type of questions like problem solving, comprehension, factual remembrance, recall type. Okay. And also there are highlights of this Manipal MedAce app in terms of faculty connect, recent updates, study plan, and you have a whole range of tests available, subject-wise, grant test, revision test. Okay. So these are all the advantages of having a MedAce app. Hope you will have a pleasurable learning experience with MedAce app. Thank you for your kind listening.